So my message, and my final message, maybe the final message I give you from this podium, is that please, for your own safety, for that of your family, get your updated COVID-19 shot as soon as you're eligible.
Well, hard to follow Dr. Fauci, who I would argue has been the most important, consequential public servant in the United States in the last half century, and a leader and a role model for so many of us. So, Tony, thank you.
Dr. Anthony Fauci at his last White House briefing before he retires, urging Americans to get vaccinated as we head into the holiday season. As families gather and travel increases, fears that cases of COVID, flu, and RSV could all rise at the same time. White House COVID response coordinator Dr. Ashish Jha is here to discuss the latest. Joining me now, it's very great to see you, and here in the studio, I think, for the first time. So great to see you. You heard Dr. Fauci. The administration is launching a new campaign urging people to get those flu shots, get those COVID boosters. But I think only about 11% have gotten the booster so far, maybe 42 million the flu shot. We've talked about this so many times. People aren't listening. What do you do?
Well, first of all, good morning. Thank you for having me here. So, look, it's been obviously a long 2.5 years for Americans, and we understand that people want to move on. The good news is people can move on if they keep their immunity up to date. I really think when you look historically, people tend to get their flu shot in November and December into January. I think we're going to see a lot more people getting vaccinated in the upcoming weeks. This is why we're launching the campaign we are right now, because we think it's incredibly important as we head into the holidays for people to update their immunity, get the new COVID vaccine, get the flu shot. It's a great way to stay safe and healthy this holiday season.
There's also this UCLA study that says that adult flu vaccination rates have declined in states where COVID vaccination rates are also low. So are you concerned that the controversy and hesitancy over COVID vaccines is carrying over to flu vaccines?
So, look, here's what we know. We know these vaccines, first of all, are incredibly effective. They're very safe. So that's point number one. I think point number two is we know people get vaccinated when they hear it from trusted voices. So our strategy is get out into the community, talk to religious leaders, talk to civil society leaders, community-based organizations, have them get out into the community and talk to people. I really believe if we do that and we continue pursuing that strategy, more and more Americans are going to get vaccinated.
And there's this new subvariant of Omicron spreading in Massachusetts, your home state there. Experts say it accounts for nearly 40% of the cases there in the state. Do these updated vaccines help with that?
They do. So
well, that's good news.
It is really good news, right? So we made a decision over the summer to update the vaccine with a BA.5 bivalent vaccine. The FDA made that decision. Now, these new subvariants that are coming out, BQ.1.1, again, there's an alphabet soup here, that is a derivative of BA.5. And the good news is that the vaccines hold up well against that subvariant and other subvariants we're seeing emerge across the country. So one of the many reasons why I think it's critical for Americans to go get the new updated COVID vaccine is it's not going to just protect you against the virus that's been out there, but it's also going to protect you against these new subvariants that are emerging just as we're heading into the holiday season.
Excellent news. Get those boosters. Let's talk about this triple-demic, however. The flu, COVID, the respiratory virus, RSV, which is affecting children and the elderly. We're seeing hospitals getting close to capacity. What should parents do in particular?
Yeah, it's a very good question. So here's how I think about it. We do have 3 infectious respiratory viruses, as you said, flu, RSV, and COVID, all out there. The good news, Martha, is we have 2 highly effective vaccines against 2 of them. So the first thing that I think every parent should do, what I've done with my children, what I've recommended, is get everybody in the family vaccinated against flu and against COVID. That takes those 2 and takes them off the table in terms of causing serious illness. RSV, for most people, not a big deal. It's very mild. For the elderly and for the youngest kids, it can be a problem. So then it's just about basic respiratory hygiene that we know about, right? Avoiding sick contacts. If your kid is sick, keeping them at home, washing your hands, cleaning surfaces. There's a set of things that really make a difference with RSV. And we think that if people do that, it really can make a difference. One bit of good news, just in the last week, we've seen RSV peak and maybe turn down. I'm obviously hopeful that that trend is going to continue. If it does, I think we're going to get through the next few
And what about this shortage of amoxicillin and even ibuprofen in some places?
Yeah.
What do they do about that?
Yeah, this is, we have some broader supply chain issues with our medications that we've had for decades. I have seen this as a practicing clinician. I often, when I walk into the hospital, find some normal medicine that I'm used to using not available. We have got to continue working on that. We've made a lot of strides in this administration, but our work here is not done. So we have got to continue making sure that these medicines are available. I will tell you, the good news is plenty of vaccines for flu and COVID, plenty of treatments for flu and COVID. Those are still out there. We have plenty of those, but we've got to work on the other things.
And I want to finally ask you about China. You've seen the protests, just extreme lockdowns in China when they get cases, people really starting to rise up in a way. When you look at what they're doing, is that effective?
Yeah, so China has pursued a zero COVID strategy. Obviously, that is not our strategy. We don't think that's realistic, certainly not realistic for the American people. Our strategy has been build up immunity in the population by getting people vaccinated. That's how you manage an incredibly contagious variant like Omicron. I think it's going to be very, very difficult for China to be able to contain this through their zero COVID strategy. I would recommend that they pursue the strategy of making sure everybody gets vaccinated, particularly their elderly. That, I think, is the path out of this virus. Lockdowns and zero COVID is going to be very difficult to sustain.
That could have a worldwide effect, that's for sure. Great to see you, as always.
Thank you
very much, Dr. Jha.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.